The ultimate goal of CLAUD-IT is to improve implementation of clinical audit in EU member states. Audit is an essential quality improvement tool. However, the level of implementation in EU member states varies considerably. We have certain countries having a long-standing audit culture. However, having said that, especially the bigger countries like Germany, Italy, France, Spain, have no real audit culture. And I would say the level of implementation could be better in these countries. So we have several main barriers for the insufficient clinical audit implementation. Barrier number one is insufficient resources. To do good clinical audit, you need significant resources, you need time, you need funding, you need personnel. Number two is a lack of a standardized infrastructure. We don't have one clinical audit infrastructure, which of course would make things much easier, and that is actually one of the things we really try to address in the EU-funded CLAUD-IT project. Barrier number three I would call resistance to change. Of course, it is always a little bit difficult, especially in the medical world, to change certain practices which had been this way for 20, 30 years. And of course, you need good arguments to do that. The fourth reason is lack of training and awareness. We do not have such an audit culture. We have, for example, in the UK, where even final year medical students and residents have to plan to conduct audits every year. And we do not have that in most other countries. So people are not so familiar with that. And this is also one of the key issues we try to address with our project. So CLAUD-IT follows a multi-stage methodology. First stage is about identifying the major needs. Second stage is about addressing these needs by developing audit-related material. We just started by publishing the new Audit Rat Guide to Clinical Audit, which contains more than 80 templates. And we will continue these efforts by developing a so-called audit cookbook, which is a step-by-step guide how to start and how to conduct clinical audits. And the third stage is about actually doing audit, and we will do 2 rounds of clinical audit, and in this way we'll try to have a really good dissemination in order to improve the implementation. So I think CLAUD-IT is a very important project for 2 reasons. First reason is from a legal point of view. We have to adhere to the Basic Safety Standards Directive, which mandates clinical audit. Second is from a medical point of view, because of course we aim to provide the best healthcare in radiology and nuclear medicine possible. So in order to foster a widespread implementation, we will publish all the material we develop during the course of the project online. And of course, you are more than welcome to download it and use it in your daily clinical practice.